Welcome to the Breezing Oral Health and Non-Communicable Diseases, a podcast from the World Federation of Public Health Associations. I'm your host, Dr. Pyakurel, currently the co-chair of NCD Working Group at World Federation of Public Health Association. Every episode of our series explores how oral health connects with different non-communicable diseases. Last episode, we linked oral health care and cancer, which was moderated by Dr. Oviola, who is the upcoming chair for oral health group at World Federation of Public Health Association. The podcast had an overwhelming reach, crossing more than 850 views through WFPHA social media page, reaching wider global audience. On to our second episode of this podcast series, we look forward in dissecting the challenges that we have faced for tobacco control. Tobacco consumption continues to be one of the leading cause of preventable death worldwide. Even after decades of laws and awareness campaigns addressing harmful effects of tobacco there are still numerous hurdles to effective tobacco control. In this episode, we will talk about the creative solution and tactics behind to use to get past these challenges. Whether you are a policymaker, health advocate, or just interested in the topics, this conversation will offer insightful information about one of the most enduring global health issues. I'm excited to welcome two remarkable experts who will share their insights and experience on this journey. First, we have Dr. Neetu Sinha. She is a highly qualified dental professional with a Master of Dental Surgery, MDS in Oral Pathology, Microbiology, and Forensic Odontology from Narsingh Patel Dental College in Gujarat. With extensive experience spanning over a decade, she had worked as a dental surgeon, lecturer in oral and maxillofacial surgery, and dentist in various prestigious institutions. Notably, she has contributed to the National Oral Health Program at Sadar Hospital in Jharkhand, focusing on advocacy, screenings, and oral health camps. Currently, she works as a consultant at Karkinos Health Center Women's Wellness Program, conducting screening for oral, cervical, and breast cancer. She currently maintains her dental practice at Vedas Dentry.
Thank you so much for the nice introduction. It's a pleasure to be here. Thank you.
Thank you, Dr. Neetu. Joining us also is Dr. Pranil Singh Pradhan, an associate professor in Department of Community Medicine and Public Health at Institute of Medicine, Tribhuvan University, Nepal. After completing his postgraduate at BP Koela Institute of Health Sciences, he earned prestigious fellowship in Translational Research Capacity Building Project. He is a Banan Lounge Scholar in Cardiovascular Health Program at Harvard THN School of Public Health and also has a diploma in Global Health. He is also the current president of Nepalese Society of Community Medicine. He is an academic editor to many international journals. He is a member of Institutional Review Committee, has extensively worked in public health, including NCDs, and was also a recipient of Young Health Research Award by Nepal Health Research Council in 2019. Welcome to our show, Dr. Pranil.
Yes, thank you, Dr. Prajjwal. Uh, I'm quite excited for this podcast. Thank you.
Thank you very much. Thank you, both of you, for being here. So my first questions will be, let's start with the basics. Dr. Neetu, can you explain the concept of oral health as a window to broader health, particularly in relation to tobacco use? And Dr. Pranil, what are the types of tobacco that people use? Are there any safer ones?
Thank you, Dr. Prajjwal, for the wonderful question because mouth is the window to the systemic health because it not only shows the effects of systemic diseases, it manifests all the signs and symptoms of various systemic conditions, including heart diseases, diabetes, stroke. But it also has a bilateral effect. The oral condition also has effect on the systemic conditions. And as far as tobacco is concerned, in relation to tobacco use, we see poor oral hygiene, gum diseases, tooth loss commonly manifesting in the oral cavity. But I would like to pay more emphasis on the oral potentially malignant disorders, which are precursors to oral cancer. We see lots of cases of leukoplegia in people who consume tobacco in the form of khani. And we see oral submucous fibrosis in people who consume areca nut and tobacco as pan masalas. So I believe oral examination can aid and support in early diagnosis of oral cancers.
Thank you, Dr. Neetu. Dr. Pranil, So, what are the types of tobacco that people used, and are there any safer ones?
There are two types of tobacco products. The first would be the combustible products or the smoked tobacco products, and the second is the smokeless tobacco products. So when you talk about combustible tobacco products, there are cigarettes and cigars, which basically you are inhaling the tobacco by burning the tobacco leaves. Then there are like pipes where you burn the tobacco in a bowl and then you inhale the smoke through a stem. There are hookahs and there are shishas where the tobacco is heated, and then the smoke is filtered through the water and the user inhales the smoke. So, and there are locally made BDs, which are basically hand rolled type of cigarettes, originating mainly from Southeast Asian countries. And when you talk about smokeless tobacco products, there are chewing tobacco, a few examples Dr. Neetu has already told. Then there are snuff, which is a powdered kind of tobacco which we inhale, through the nose. And there are snuffs, so it's a kind of a moist tobacco product which is kept in the lips. And nowadays, we are all familiar with electronic cigarettes and vaping devices, which is basically these are battery powered nicotine delivery devices rather than conventional cigarettes. So basically, we are not burning any tobacco here, but we are using battery power to heat the nicotine cartridge, and that produces the nicotine vapors with certain flavors mixed, and the user inhales that. So, as in response to your question, whether there are any safer type of tobacco products. So, no tobacco product is considered to be safe. All forms of tobacco have significant health risks, like combustible or smoked tobacco products are considered to be, very harmful. And the smokeless tobacco products are strongly associated with oral cancers. Now, electronic cigarettes nowadays are strongly, you know, uh, advertised as an alternative to quit the conventional, cigarettes. But even the World Health Organization and other agencies have repeatedly said that there is no sufficient evidence so far to, conclude that electronic cigarettes are the safer alternative to conventional tobacco products. So for now, we can say that no tobacco products are, there are no safer forms of tobacco products. Thank you.
Thank you, Dr. Neetu and Dr. Pranil. Now we will move to our next question. Now that we understand harmful effect of tobacco use, Dr. Neetu, how do social determinants of health, such as income, education, and access to healthcare, influence tobacco-related oral health problems?
A very nice topic to deal upon, because social determinants we have seen are the factors which shape people's risk of starting as well as continuing tobacco use greatly. As we all know, the income determines the individual's use of tobacco, because poverty creates a vicious circle of tobacco addiction. And although lower literacy rates have been associated with increased tobacco use, but peer pressure as well as marketing is having an influence, especially on the youngsters. So, literacy may not, but education and awareness directly impact tobacco use. We are seeing nowadays access of healthcare is there in general, but if we concern mostly with tobacco use, there is significant lack of experts who have experience or expertise in cessation activities. So we need more people trained in tobacco cessation activities so that they can conduct such studies, conduct such activities, follow up, and maintain a constant monitoring. Because what we see in healthcare, very few of the healthcare professionals take tobacco history or suggest to quit. So we need to change that. Thank you.
Thank you, Dr. Neetu. And now, Dr. Pranil, could you share some of the challenges for tobacco control in a global scale?
Yeah, this is a very important question, actually. So I think the strongest challenge is this constant influence of tobacco industries on policymakers of the country. So, the tobacco industries are constantly putting different forms of, pressure to the country's government in one way or the other. And this is basically hindering the tobacco control efforts that the country is, putting in. And there are plenty of examples, especially from, from our context, where, people with investment in tobacco companies themselves are in a policy making position, and that poses a huge conflict of interest as well, and that is a major barrier to advance any type of tobacco control policies in the country. And there are other issues like there is an illicit trade of tobacco, and this illicit trade usually allows cheaper products which are unregulated products to go into the market. And there are, as I mentioned earlier, there are electronic cigarettes. These are the newer, challenges in the field of tobacco control, because most of the tobacco control policies, they strongly, they are focused on conventional tobacco products, but somehow they are, still they have not strongly made regulations against these electronic cigarettes as well. And for tobacco control initiatives to be effective, it requires a very focused and sustained, political commitment from the country, and it requires, lots of resources as well. And especially when we talk about resource limited settings, resource limited countries, we don't have that much resources to invest in tobacco control. And that is closely related to the funding, or how much funding is available, how much resources is available to support this campaign. So all these factors have a combined role, and this leads to certain gaps and certain weak areas where the tobacco companies can play their strategies, they can execute these strategies in these loopholes. So I think these are some of the major challenges for tobacco control.
Thank you, Dr. Pranil. Now let's look at the patient journey. Dr. Neetu, what oral health challenges do you typically see in patients with tobacco use? How do they add to the burden of NCDs?
From the patient's point of view, mainly the challenges we see regarding oral health are like dental hygiene, very poor dental hygiene, stained teeth, loss of teeth. And the main challenge as a health professional that I face is motivating them to quit and following them up. And another very important one, which I regularly emphasize on, is regular screening for oral potentially malignant disorders, because they are asymptomatic, and after chronic use of tobacco, the patients, they have no symptoms, so though they don't visit clinicians or health professionals, and hence we have this delay in diagnosis for oral cancers. And as far as NCDs are concerned, studies have found that more than 90% of the NCDs have tobacco as an etiology, whether it is hypertension or diabetes or heart disease or respiratory diseases, chronic obstructive pulmonary disorders. So, tobacco is one of the main etiologies for NCDs, and more than 50% of cancers again have tobacco as an etiology or a cause. So we can see that tobacco is cause for a major chunk of burden for the NCDs, and preventing tobacco use and promoting tobacco cessation activities will go a long way in curbing this epidemic of NCDs. Thank you.
Thank you, Dr. Neetu. Dr. Pranil, what is Framework Convention of Tobacco Control and how it has been implemented in different parts of the world? Can you share some of the success stories of effective implementation of FCTC in global health?
Framework Convention on Tobacco Control, or the WHO Framework Convention on Tobacco Control, is a global evidence-based treaty, as we see. It was adopted by the World Health Assembly in 2003, and it entered into force in 2005. So basically, WHO FCTC recognizes that tobacco epidemic is a global problem, and it has a very serious consequences for public health. And this aims to save lives through preventing and controlling the use of different types of tobacco products. Currently, there are 183 member states or parties to this convention, including the EU, European Union. So this itself, demonstrates how important this WHO FCTC is to all the countries. With regard to some of the successful examples of FCTC implementation, so recently it was the FCTC completed its 20 years of implementation. So if you look at the achievements in these 20 years, there are lots of countries which have ratified this convention. And all the activities related to tobacco control following this ratification was associated with 24 million fewer, younger people taking up this habit, and then more than 2 million people quitting the tobacco. So it was a significant achievement of this FCTC. And South America also became the first sub-region of the Americas to become completely smoke-free. So thanks to all the activities related to FCTC that was done in the countries over there. And Nepal itself was a success story of implementation of FCTC, because at that time when Nepal had signed the convention, and Nepal was about to pass the legislation or the regulations against tobacco, there was a huge opposition from the tobacco companies. They tried to influence the policymakers. They tried to resist the government. They tried to, they tried various tactics to stop the government from passing this legislation. But, with combined effort, the Nepal government was able to, successfully pass the legislation in 2011 after ratifying the FCTC in 2006. So despite the delay, the Nepal government was able to pass the legislation against tobacco despite very strong opposition. So I think these are very good examples of the FCTC implementation in the different parts of the world. Thank you.
Thank you, Dr. Pranil. Speaking of smoking, Dr. Neetu, how early do smoking initiation start? Why there is a rampant consumption of smokeless tobacco product in the South Asian region? And what evidence do we have so far on the harmful effect of vaping?
As far as the initiation age of initiation is concerned, most of the literature mentions around 12 to 15 years, which is a very concerning thing. And while the GATS survey in India, which was done in 2016-2017, that mentions a rise in age. Initially, it was 17, and now it mentioned 18 years of age. But the ground reality that we see in field is that the 12 to 15 years age is very commonly seen for both smoking form as well as the smokeless form of tobacco, especially in Southeast Asia. And as far as the provenance of use of smokeless tobacco is concerned, the reasons are multifactorial, Dr. Prajjwal, because we see that in Southeast Asia, there is a cultural and social acceptance of smokeless tobacco. And then we see that the poverty and education levels, they again impact the continuation and use of tobacco. And as Dr. Pranil mentioned, the regulatory norms are very poor in Southeast Asia. There are not stricter rules, although we are coming up with such wins against the big tobacco industries. But there are still lots of loopholes which allow the marketing as well as poor quality manufacturing of the products. So these loopholes are utilized by the manufacturers, and this brings the cost down, which makes it more affordable to be used by poor people. So all these factors contribute to creating a niche, and the targeted marketing that we see regarding the smokeless forms like pan masala is very prominent in Southeast Asia. So these factors have to be tackled by in a contextual and I believe a population and culture specific program for tobacco cessation. As far as India is concerned, because the electronic cigarettes are banned there, so we don't have that use. But worldwide, globally, what I have seen is like all the studies point that they have similar effects, harmful effects as the smoked or chewable forms. So they are not to be considered as an alternative to to smoking or chewing form of tobacco. Secondly, they should not be considered as a mode of quitting tobacco. So, vaping is equally dangerous and harmful as other forms of tobacco. That is what the studies say.
Thank you, Dr. Neetu. Dr. Pranil, could you walk us through how these big tobacco companies circumvent anti-tobacco laws?
This is another important question that we need to be aware of. There are various tactics that tobacco companies employ to, find their way around the different tobacco control regulations that are present in the country. So one is very strong lobbying. So tobacco companies have very, hidden stronger voice inside the government to push through their agendas. And tobacco companies can even, they are very rich, so they have enough funding to either fund their research to create doubtful evidence on the ill health effects of tobacco, or even use different types of lobbying groups to create kind of public illusion, yeah, to hinder the progress in tobacco control regulations. And in many countries, tobacco companies themselves are the biggest taxpayers. At least in Nepal, tobacco company is the biggest taxpayer to the government. And every year, that company receives award of recognition by the government. So, that makes it very difficult for the government to pass any legislations against that are strictly against, tobacco control. And as I had also already mentioned previously, there is this issue of conflict of interest. So, there are people who have huge investments in tobacco companies and themselves are in the level of policy making in the parliament. So that is itself a very difficult situation. And at this point, I want to share a recent example that happened in Nepal. It's a recent example. So the Ministry of Health and Population of Nepal had issued a fresh directive to the tobacco companies to increase the area of these pictorial health warnings. Previously, it was 90%, and the fresh directive from the ministry was to increase the area of pictorial health warnings to 100%. So here, so 100% of the tobacco packs, front and back, should be covered by the pictorial health warnings. That was the recent directive by the health ministry, and this made Nepal the first country to pass such legislation that the 100% of the tobacco pack had to be covered with pictorial health warnings. But then uh, it was the Ministry of Industries which came forward and wrote to Ministry of Health and Population that to stop the implementation of this directive and maintain the current status of this pictorial health warning and not to increase it. So this clearly signals that there is some sort of influence from the other, outside influence to the concerned ministry, which is trying to, put some influence on the health ministry to stop this directive. So that type of influences was seen in Nepal here. So this is just an example of how what type of tactics that tobacco companies are recently playing. And Another issue is this issue of electronic cigarettes also. So as if you look at the global trend, the trend of smoking conventional cigarettes is kind of following a downward trend. And analyzing this trend now, tobacco companies have started investing on mostly on the electronic cigarettes, and they are also trying to promote this as a safer or a healthier alternative to conventional cigarette smoking. So they are also expanding their markets, targeting the youth and the adolescent population. So this is another strategy that the tobacco companies are investing in. And at the same time, in resource limited countries like Nepal, there are no clear cut or stricter laws against electronic tobacco products. So again, that makes it a playground for tobacco companies to uh, put forward their strategies. So these are some of the ways how tobacco companies are creating their influence and trying to circumvent the anti-tobacco laws. Thank you.
Thank you, Dr. Pranil. Dr. Neetu, what kind of strategies have you found that work best for tobacco cessation?
Dr. Prajjwal, during my experience in the tobacco cessation clinic, at the individual level, I found that a personalized program with an achievable target is more likely to succeed. And we use behavioral counseling, either a brief or intensive, depending on the location. We use cognitive behavioral therapy or motivational interviewing for motivating the patients to quit. Then, along with this, there are certain medications are also available, whether it is nicotine replacement therapy in the form of nicotine gums, lozenges, patches, or non-nicotine therapy like some drugs like bupropion, which aid in supporting the patients during the withdrawal symptoms, reducing the cravings, etc. Then there are certain apps also, digital apps like M Health app and Quit Now app and tobacco free apps, which send patients SMS or reminders to keep them motivated or ask them to come for the next appointment. So these work at an individual level. And at a community level, we conducted school or college health programs, like we have a tobacco free educational institution programs to make kids and teachers more aware of the harms of tobacco, or community awareness programs. And we need to create community support groups also, so that the person who is quitting has a support group. And along with all these things, the policy level changes, as mentioned by Dr. Pranil, will go a very long way, because that is the one thing that will contribute in a big way to aid in tobacco cessation activities. Thank you.
Thank you, Dr. Neetu. Dr. Pranil, what are the novel strategies stemming from scientific studies in reducing smoking prevalence and the way of rehabilitation for chronic smokers?
The WHO has introduced this package called Empower. So it's a policy package which is intended to assist in the country level implementation of different types of interventions to reduce the demand of tobacco. And this has been emphasized by WHO FCTC as well. So Empower basically consists of six evidence-based components. M stands for monitoring tobacco use and prevention policies. P is protecting people from tobacco smoke. O is offering help to quit tobacco use, as explained by Dr. Neetu. Then W is for warning about the dangers of tobacco use. The example that I mentioned previously, the pictorial health warnings, that comes here. Then enforcing, E stands for enforcing bans on tobacco advertisement, promotion, and any sort of tobacco sponsorship. Then R stands for raising taxes on tobacco. So these are the evidence-based strategies, evidence-based policy level strategies that are, that work best for tobacco cessation. Now, for chronic smokers, Dr. Neetu has already explained, different modalities for encouraging the smokers to quit tobacco use. Just to briefly, repeat what she already revise what she already mentioned, there are behavioral interventions and pharmacotherapy that are meant to assist in quitting tobacco use, and different newer technologies are also coming up, like mobile-based apps, AI chatbots are also available, telecounseling, social media platforms are also available. So it all depends upon what the user finds it more friendly to interact with, and what facilities are available in the country.
Thank you, Dr. Pranil. Now, this will be my last question. So, Dr. Neetu, how can dentists, other healthcare professionals, and community workers be better equipped to address tobacco use during routine oral health checkups?
Very pertinent question, Dr. Prajjwal, because dentists are the first point of contact for oral health problems, and they are the first person to identify the tobacco habit also. But it will be useful if all the other health professionals also have this habit of mentioning and recording tobacco habits. And in the long run, if this is mentioned in the electronic health records, it will act as a red signal to initiate programs for cessation. And secondly, for dentists as well as other healthcare professionals, we need a very large scale education and training program in tobacco cessation. Although dentists and other health professionals are knowledgeable about their medical conditions, everything they study, but I feel they feel inadequacy in in advising for quitting. So more training and more education regarding the tobacco cessation activities are required for health professionals. And as far as community workers are they're needed, they also need training, but their training is more in identifying the oral health problems, motivating the individuals in the community to quit tobacco, and referring those individuals to appropriate cessation centers. And in the end, we need a proper integration of all the health professionals and the community to make tobacco cessation a success.
Thank you, Dr. Neetu. And Dr. Pranil, how can LMIC keep up the fight against tobacco use and create tobacco champions?
As I mentioned previously, the empower measures is the best evidence-based strategy that LMICs can implement and continue this fight against tobacco use, because this is going to be a very long battle against uh, tobacco. And basically, these strategies are focused on implementing comprehensive tobacco control policies, raising taxes against tobacco use, enacting smoke-free policies, and promoting the cessation support, as mentioned previously, and also engaging different communities and empowering the individuals to advocate for healthier choices. And we can create tobacco champions by empowering these individuals and communities which are very passionate against tobacco use, provide trainings on tobacco control, provide trainings on tobacco cessation to health professionals, uh, to encourage more and more users to quit tobacco. Also, equip them with the necessary skills and knowledge, like the experts like ourselves can disseminate you know our knowledge and create champions in the newer generation. Then a very strong coalition or is required among the different stakeholders, because only the government is not able to stop the tobacco companies. There needs to be a very strong coalition between different stakeholders, including the government. There needs to be non-governmental partners. There needs to be academic involvement as well, and there needs to be local level involvement also. So whenever a tobacco company is, throwing out some other strategy or advertisement or sponsorship in the media, there needs to be a group who says, "Stop! This is wrong. This is against the regulation." So that type of voice has to come out. So only if we develop a very strong relationship, very strong collaboration with the different stakeholders, this will be possible in the long run.
Thank you, Dr. Pranil. So thank you very much, Dr. Neetu and Dr. Pranil. That brings us to the end of today's episode on overcoming challenges for tobacco control. A big thank you to Dr. Neetu and Dr. Pranil for sharing their experiences and insight with us. Your knowledge and dedication to these important issues are truly invaluable, and we are grateful for the time you have taken to help us understand the challenges and solutions in tobacco control. As we have heard today from our guest speakers on the challenges of tobacco control, from grassroots to a global scale, we definitely have solutions. What we need is commitment. To our listeners, thank you for joining us. We at World Federation of Public Health Associations hope that this episode has inspired you to think about the role we all play in addressing these public health challenges. Until next time, stay informed and take care. If you enjoyed this episode and found it useful, please join us for our next episode on oral health and cardiovascular disease, which will be broadcasted on World Heart Day. The podcast has been created by the Oral Health and Non-Communicable Disease Working Group at World Federation of Public Health Associations. Thank you and have a nice day.